Hi everyone. Today we are going to look into the list of the surgeries for which an Ayurvedic general surgeon is allowed to perform as per the uh, Indian government. So there is amendment the registration number this DL double three double zero four bar 99. So the Central Council of Indian Medicine has brought this amendment dated November 20, 2020. So this is the reference, and in this amendment, we got the things on the Hindi, and just we'll move into the English translation of that. So Central Council of Indian Medicine's notification. This is the amendment which is brought on the 19th. So I think it's between the 19th and 20th of November 2020. So there are 39 list of 39 category they have mentioned serial number. So these are the list of the surgeries which are allowed to perform by the Ayurvedic general surgeon. And simultaneously, see, this is a vernacular name like Lekhana Chedana of uh, Dushta Nijaruna. So there is a translation here. They have given the debridement, fasciotomy, and curettage. So this is the best thing they have did, as per my opinion. So for the clarification. So if any issues comes in the court of law, so this translation is very much needed because along with the vernacular names, we they have given the Western terminologies for the better understanding and for the clarification of their statement. So this is the needed. This is the need of the time, and they did it in the very right manner. Bhedana of the Vidradi, like excision, this one incision on the abscess, like breast abscess, perineal abscess, axillary abscess, cellulitis, etc. So they have started with the very simple surgeries. Means they started with the simple list like incision, drainage, and curettage, like that. And in third point, they have given the reconstructive surgeries like split skin graft, SSG, early excision and grafting, cross flapping. So these are the list of the surgeries: cross flapping, like extension flap. Okay, and means apart from the free flaps, so local flaps are allowed for the Ayurvedic surgeon. And the repair, like earlobe repair and all, etc. So such kind of surgeries are can be performed. And excision of the cyst like granthi and the neoplasms like sebaceous cyst, dermoid cyst, mucosal cyst, retention cyst, etc. Benign tumors like benign neoplasms like lipoma, fibroma, squamous, etc. Squamoma, etc. In the non-vital organs. In the non-vital organs, this is very much important. Chedana karma, excision and amputation of the gangrenous part. So even it may include like Fournier's gangrene or the dry gangrene, wet gangrene of the toe, so etc. Next is Sivana karma. So all types of Sivana karmas are allowed to perform. So like Tunasevani, Velitaka, Gopanika, Rujukranti, that is simple interpreted suture, mattress suture, subcuticular suture, and continuous sutures, and Yatha Yogam Tapiva. So as per the requirement, you can modify the suturing methods and you can perform. And hemostatic ligatures, Sandhana karma of Sira, Kandara, and Snayu. ligation and repair of the tendons and muscles, like repairing of the small tendons and small bigger tendons also, like repairing the Achilles tendon and distal tendons, so and muscles reconstructions, so that are all allowed to perform. Pranashta Shalya Nirharana, so this is removing of the metallic non-metallic foreign bodies. And coming to the orthopedic point, so slit sorry the splint and casting is allowed, that is a close reduction, immobilization, splinting and casting, and dislocations and the sandhi mokshana, that is a reduction of the dislocation and subluxation is allowed. So anchana pidana sankshepa kushabandhana is nothing but the either splint or cast. So anchana pidana, so reduction and immobilization. And coming to the udara roga nidana chikitsa, like abdominal disorders, so laparotomies and paracentesis is allowed. So in the point number 10 and the next point also they have mentioned the exploratory laparotomy. So total laparotomy is allowed. So the Ayurvedic surgeon can perform the surgeries on the abdomen, and as per the requirement he can handle the situations. And coming to the urorectal disorders, that is arsha, that is hemorrhoids. So kshara karma, that is a caustic treatment. Chedana, that is surgery. So as you know, Shushruta has mentioned four sadhanopaya of our arsha chikitsa, like kshara karma, agni karma, and beshaja and shastra karma. So the surgeon can perform the Kshara Karma, Chedana, and even the Agni Karma and the medicinal treatment also. Various methods of hemorrhectomy can perform, like rubber band ligations, sclerotherapy, IRC, radio frequency, laser ablations, etc. These are the newer advances which are coming to the practice nowadays. And Parikartika, that is fissure in so we can go for the anal dilatation, sphincterotomy, and anoplasty also. Bhagandaraj, that is the fistula and Chedana Karma, like fistulectomy, and Ksharasutra ligation, partial fistulectomy, followed by the primary threading and all we can perform. Nadi Ayurveda, Nadi Runa Chedana, that is excision of the pilonidal sinuses. So Nadi Runa, that is any kind of tubular wounds, not only the pilonidal sinus. So they are given these are the example. Apart from the vernacular names, the rest of the things are the examples for that. So or the nearby translations. So Nadiruna Chedana, so any kind of tubular wounds or fistulous tract, so you can go for the excision of that. So their intention here mentioning the 14th point is, so they wanted to refer for the pilonidal sinus. So this is for the pilonidal sinus. Buddha Brahmsha, that is rectal prolapse. So Sandhana Karma, various rectoplexes you can perform, or either you can perform the rectoplexes or else you can go for the Kshara Karma also. So nowadays, some Ayurvedic surgeons are doing a Kshara Karma for the Buddha Brahmsha, so with a very good result, and up to some extent there is a recurrence, and multiple settings may get into the proper repositioning of the rectum or anal mucosa. Ashmari Nirhana. So among the urolithiasis, only suprapubic cystolithostomy, or that is the cystolithotomy is allowed. So ureteric stones is supposed not to perform any kind of surgeries, only for the this one cysto cysto means bladder stones. The Ayurvedic surgeons can perform the surgery. Mutra graha mutra krucha. So urethral dilatation and myotomies are allowed to perform, and niruddha prakarsha, the phimosis and paraphymosis, the surgery is circumcision is allowed. So we can call it the circumcision. See, Shushoda has also mentioned the surgery for the phimosis, that is for the niruddha prakarsha. So it's just as that of the circumcision, but there is no name for that. So he says as a Shastra Karma. So what kind of Shastra Karma, how it has to be performed, circumferentially, how you have to cut this prefuse and the part, frenulum you have to spare, means you have to avoid the surgery at the frenulum area. So that will help us to get the problem in the erection if you remove the excessive frenulum. So that is all that is mentioned. But here this is means circumcision is the Western terminology. So it's just a very nearby terminology, or we can say it's an exact terminology which has copied from the Ayurveda surgery, and they have named it different way, probably. Okay, and Vruddhi Roga Chikitsa, that is hernia. Okay, Sandhana Karma, like congenital hernia, inguinal hernia, umbilical hernia, epigastric hernia, femoral hernia, incisional hernia. So you can go for herniatomy, hernioplasty, and herniorrhaphy. Mutra Vruddhi, like hydrocele, so eversion of the sac, you can go for that. Intercostal drainage, so there is no direct references in Ayurveda for the ICD and all. So they have mentioned a direct word of Western terminology, which is the emergency surgery, life-saving procedure, which is much required, and the Ayurvedic surgeon can perform that. Ligation of the hemangiomas are vascular ligations, and ligations of the varicocele, varicocele, varicose veins, stripping of the varicose veins surgery. Stana Granthi. So benign lesions or cyst tumors of the breast and lump biopsy you can perform. And see, for the Udara Roga, you can go for exploratory laparotomy. So you can identify the pathology, and as per the requirement you can perform the surgery. So foreign body removal from the stomach. So usually we use the endoscopy to remove the foreign body from the stomach. So and along with that we can go for the pyloromyotomy also. Means for the any strictures, pyloric stenosis. So Ayurvedic surgeons are allowed to perform the pyloromyotomy. Use of advanced nadi yantra. See, there are four uses that they have mentioned in the classics. That is using of the tubular instruments. Though we can take the example of the proctoscopy or sigmoidoscopy or any kind of endoscopy. So which are nothing but the tubular instruments. So Sushruta has mentioned four uses of that. So Shroto Darshanat for the visualization of the organs, Kriya Saukaryat for the betterment of the uh, work. So Kriya Saukaryat, so we can use the tubular instruments. So the video proctoscope and sigmoidoscope. So these are the two endoscopes which are allowed to perform by the Ayurvedic surgeon. Ileostomy, colostomy, resection, and anastomosis in emergency. Okay, this is need to be mentioned separately, definitely. So along with the exploratory laparotomy, so whenever they perform the exploratory laparotomy, so probably the surgeon may require to do the ileostomy, colostomy, or section of and anastomosis. So that is allowed for the Ayurvedic surgeon. Sigmoidoscopic biopsies and polypectomy. So they already mentioned the sigmoidoscopy. So along with that, they have added the uh, diagnostic procedure, that is the biopsy, and polypectomy also is a simple procedure. And along with that, Unduka Pucha Shota, so appendicectomy. So they have already mentioned the exploratory laparotomy, but they wanted to clear the things. So hence the reason they have mentioned it very separately, like ileostomy, colostomy, and anastomosis and appendicectomy. So there is no any classical or vernacular name for the appendicectomy. So they straight away put the Western terminology. And Vedana Visravana Abhyantara Vidrati. So, particularly, abscess, Shushruta has classified as the external abscess and internal abscess. Among the internal abscess, they have taken the example of the appendicular abscess, and this kind of abscess can be drained by the Ayurvedic surgeon. And this is once again, as I said, this is a direct Western terminology. They have used like a cholecystectomy. See, they have mentioned the equilateral laparotomy. So that means that so Ayurvedic surgeons can perform the cholecystectomy, appendicectomy, appendicular abscess, appendicular gangrene, and any pelvic disorders. So, but still they wanted to make it clear that what are the list of the surgery, and this is once again the life-saving procedure, laryngeal mask for the airway intubation, bag mask ventilation. So I appreciate they have not only wanted to add the rights of they wanted to not only clear the rights of the Ayurvedic surgeon, simultaneously they are wanted to clear the responsibility of the Ayurvedic surgeons also. So these are the procedures which every medical student should be trained and allowed to practice. That is laryngeal mask airway intubation, bag mask ventilation. Suprapubic cystostomy. See, this is already there in the previous point. Like I don't know why they have mentioned once again. This is a repetition of the these 2 points. That is 33 and 34. These 2 points are repetitions of the Ashmari. So already they have mentioned these two procedures in the Ashmari. So this is the repetition they have did. Excision of calcified plates, okay, and orchidopexy. So, and after finishing the abdomen and urinary tract, and they are coming to the genital tract now, and orchidectomy. So, removing of the testes they can perform with the patient consent, and varicocele and high ligations. This is once again I can say it's a repetition. So spermatocele, halocele, pyocele, hemocele drainage. So these are the list 39 list they have given, which can be these are the list of the surgeries which can be performed by the Ayurvedic surgeon. So this is all about the list of the surgeries which are allowed for the Ayurvedic surgeon. Thank you. Thanks for watching my video.